Hi friends, it is Dr. Ladda here, and today the topic of discussion is elbow joint. For the homeopathic students, it is a question for 20 marks. So, let's have a detail about the elbow joint. Now, about the introduction of joint. Elbow joint is a synovial type of hinge joint. It is a joint of upper limb. It is a joint between arm and forearm. The elbow joint is formed by the articulation of three bones. A bone from arm, that is humerus, and two bones from forearm, those are radius and ulna. The elbow is term used to, we are talking about the elbow joint. It is the term used to actually the joint between humerus and radial, that is called as humeroradial, and the joint between humerus and ulna, that is called as humeroulnar. No doubt, these two joints are joined between humerus and radius. Second is a joint between humerus and ulna. These are two joints, but with these two, the upper radioulnar joint is also included in the elbow joint because it is a supporting and a part and parcel of the elbow. Radius and ulna had two joints at the upper end, one joint at the upper part and second joint at the lower part. So the joint between radius and ulna at the upper part, the joint between humerus and radial, that is humeroradial, the joint between humerus and ulna, that is humeroulnar. So these are combinedly known as elbow joint. And so the articular surfaces of elbow means the articular surface of the humerus, the articular surface of radius, ulna. The articular surfaces of elbow are separated from each other by means of a hyaline cartilage. And the joint is highly vascular joint, means vascular, and it is means anastomosis is there, and it has a synovial fluid inside to prevent the friction. This is what about the introduction of joint. Now shift to the bones which are forming the joint. The bones which are taking part in the formation of joint are a bone from arm and two bone from forearm. A bone from arm is humerus and the bone from forearm are radius and ulna. About the articular surfaces, the third heading is the joint has upper and lower articular surfaces. The upper articular surface of the joint is mainly formed by capitulum and trochlea of the humerus. But your radial and coronoid fossa also play an important role for the elbow joint. Now, what is the role of radial fossa? Radial fossa allow the fitting of a radial head during the flexion of the your upper limb, flexion of the forearm. And in the same sense, the second part is coronoid fossa. So this coronoid fossa, which is just above the trochlea, allow the fitting of coronoid process of ulna. Allow the fitting of coronoid process of ulna during extreme flexion. Means to prevent the further flexion of the joint above 90 degree, these two things, radial fossa and coronoid fossa, are playing role. Now the lower articular surfaces are provided by radius and ulna. What radius provides? The upper surface of head of radius. And this upper surface of head of radius articulate with the capitulum of the humerus. And so this articulation of head of radius with the capitulum of humerus, this leads to form a joint that is called as humeroradial joint. Now the next, like the radius, ulna is also taking part separately. And the trochlear notch of the proximal portion of ulna, it get articulated with the trochlea of humerus. And this trochlear notch with the trochlea of humerus, that leads to form humeroulnar joint. Now means this humeroulnar and humeroradial joints are the joints that gives a hinge type of characteristic to the elbow. Now elbow joint is continuous with the superior radio-ulnar joint. Elbow is actually the continuation with the superior radio-ulnar joint also. Means three things. Humeroradial, second one is humeroulnar, and third one is radio-ulnar. Means the joint between upper joint between radius and ulna. Proximal radio-ulnar joint is functionally a pivot type of joint. Pivot type of joint which helps for the rotational movement of the radius and ulna. Now this humeroradial, humeroulnar and superior radio-ulnar joint are together known as cuboidal articulation. Cuboidal fossa, cuboidal articulation. Next thing is the ligaments of joint. Now this joint, which elbow joint, that connects the bones forming the elbow are by means of ligaments. Ligaments are providing more strength to the joint. There are three main ligaments of the elbow joint. And those are, one is capsular ligament, second one is collateral towards ulnar side, that is ulnar collateral ligament. In the same sense, collateral towards the radial side, that is radial collateral ligament. Now move one by one. Start with the capsular ligament. Capsule covering of whole joint. So definitely this ligament has attachments at the upper and the lower part. So the capsular ligament at the superior aspect, it is attached to the lower end of the humerus in such a way that the trochlea, capitulum, radial fossa, coronoid fossa and olecranon fossa are covered by the capsule. It is attached superiorly in this way that the trochlea, capitulum, radial fossa, coronoid fossa and olecranon fossa are covered by the capsule. Now inferiorly it has attachment with inferiomedial aspect and inferolateral aspect. Towards the inferiomedial aspect, it is attached to the margin of trochlear notch of ulna, as ulna is situated medially. And inferolaterally it is attached to the, actually it should attach to the radius, but here it is attached to the annular ligament of superior radio-ulnar joint. Annular ligament of superior radio-ulnar joint. Now this is what about the capsular ligament. Now the next ligament is a ligament concerned with the ulna, that is ulnar collateral ligament. So this ulnar collateral ligament, it extends from Ulna is towards medially, so surely it extends from medial epicondyle of the humerus to the coronoid process of ulna. Medial epicondyle of the humerus to the coronoid process of ulna, and naturally this ulnar collateral ligament helps to connect ulna and humerus. This ligament is a triangular shaped ligament and it has three bands: anterior band, posterior band, and inferior band. Now your third ligament is, just we finished the ulnar collateral, now the next is radial collateral. The radial collateral ligament is a fan shaped band, whereas the ulnar collateral ligament, it is a triangular shaped. A radial collateral is a fan shaped band. It has a attachment to the lateral epicondyle of the humerus. And now what happened? The distal fibers blend with the annular ligament that enclose the head of radius. The lower fibers, the fibers which are coming down, they blend with the annular ligament so that they can close the head of radius. So this is about the radiocollateral. So three ligaments: capsular ligament, ulnar collateral ligament, and radiocollateral ligament. Capsular covering whole joint, ulnar collateral towards ulna, radial collateral towards radial. The remaining part of the elbow joint, including the blood supply and nerve supply, even with the blood supply, I will try to explain the elbow anastomosis, and the movements of elbow joint will be taken in the next video, and I will present it within few days.